Well, hello, everybody. This is Congressman Adam Kinzinger. Obviously, it's an interesting time we're in right now, and what I wanted to do is to reach out and have a call where we can talk a little bit both about what Washington's doing, but also some medical questions, any questions that people have, any answers to things they're wondering. It's obviously a very difficult time for all of us, for our families, for the economy. We're in moments that we never, frankly, expected to be in, and so that's where we are. I wanted to take an opportunity tonight and just chat with you about this. We do have a special guest tonight, and I'll introduce him in a second to give a bit of an opening thought, and then what we want to do is take your questions. So *3, if you're on the line, I'm going to repeat this a bunch, but *3, if you guys want to ask a question, that'll get you through to the queue. You'll be able to hear everything that's going on, but that'll get you in line. And it can be a question about what the government's doing or some of the concerns or a thought. And then also we have a very special guest on the line, a very well-known doctor on these issues. And so you can have questions for him as well. And we're going to take a second to introduce him in a bit because we're still going to be getting people on the line. But like I said, it's just a very difficult time right now, and we want to make sure that we, get the answers to the questions that we have, that we talk about where these concerns are and where to go next, and kind of what the end game is, what the next step is. But again, if you're just joining the call, it's *3, *3 to ask a question, and we'll get through as many of these as we can. So as you may have seen, Washington, D.C., we're still dealing with kind of this next, we'll call it stimulus package, the thing dealing with these concerns we have with the economy. We want to get out of the posture we're in as soon as possible, but we also want to do it the right way to make sure the most vulnerable among us are safe, that they, get the best care available, that there is care available to them. And I'll talk more about that in a bit. Again, if you want to ask a question, just hit *3. But I want to introduce our special guest right now. I'm pleased to welcome Dr. Max Brito to our call today, and I want to thank him for taking time out of his really busy schedule, especially now, to share his insights and to answer some questions that I know we all have on what's happening with things like tests, what more we can do to stop the spread of this virus in our community. Dr. Brito is the director of the U of I Urban Global Medicine Program and the chief of infectious disease at the Jesse Brown VA Medical Center. He's a professor at U of I, and we're grateful to his service in our region. Dr. Brito, I'm going to swing this over to you and have you share an update with everyone on what you're seeing, any insights you can provide to us. And I'm going to remind people again, if you want to ask a question, hit *3. So Dr. Brito, thank you, and floor is yours.
Thank you for the invitation, Congressman. It is a true pleasure to be with you and your constituents and today to talk a little bit about coronavirus. And I wanted to start with explaining or bringing everybody up to date as to what the situation is in the state of Illinois. As of today, there are 1,285 positive cases confirmed of the coronavirus. 236 of these cases were reported just today. And we've had 12 deaths from coronavirus reported in the state. And as you know, we're on a stay-home order, ordered by the governor of Illinois a few days ago. The hospital situation, what we're seeing, I practice at the University of Illinois, the state school at the Chicago campus. We're seeing we have a number of positives right now. We have in our hospital, we have about 10 or 11 positives. We've tested more than 200 people. And we're starting to do, in our hospital, testing off-site so that patients don't have to come all the way to the hospital to get testing. As you know, coronaviruses are regular viruses in the population. I mean, some of the common cold is a coronavirus, but occasionally you would have these viruses that are much more pathogenic, and these can come from animals, like in the case of this particular strain, we think it came from a market animal. And then they cross over to the human population and they cause this disease, this pandemic, because we don't have any immunity to it. We've never seen it before. And then it transmits very quickly between humans, and that's where we're at. I mean, an epidemic that started in a small market in a city in China now has spread all over the world, just to a testament of the power of nature. And so I'm open to any questions that you may have, any doubts, any concerns, and I'll be happy to answer that.
Well, thank you, Doctor. This, again, for those just joining, this is Congressman Kinzinger. I'm here with Dr. Brito. Again, *3 if you want to ask a question. We have some good questions that are ready to ask. But let me start, Doctor, by asking you a question. What are you recommending for somebody if they have symptoms? When's the time to get tested? And if you don't get tested, so if, your doctor says stay at home, we don't have enough tests or whatever the case may be, how do you know if you had the virus and 15 days later if you can go outside or not? What are you recommending?
Yeah, so the problem we're facing with testing is that, so it might not be widely available everywhere. And we have a lot of people coming in that require medical care that we're administering testing to. So what we're generally are trying to tell the population is if you have a flu-like symptoms, the body aches, if you have the fever, if you have the headaches, but it's a situation like what you've experienced in the past with the flu, and then you wouldn't go to the doctor for that, but you would have the disease and you'll stay at home. We're asking you to stay at home, knowing if this is coronavirus or if this is the flu. Right now, in a pandemic situation, is not that important. If you stay home and you stay isolated, and you avoid contact with others so that you avoid passing the disease to others, then it would be fine. That would be okay. However, if you have symptoms, if you feel like you need to go to the hospital because you're very sick, and especially this disease can make you short of breath. So if you have shortness of breath, which is an acute sign, it's something that you need to seek medical attention for, then by all means, you should go to the nearest emergency room or call your doctor for guidance. Just to be more specific about your question, Congressman, I would just say if you have flu-like symptoms at the moment, the first thing I would do is I would call your regular provider, your regular doctor, your regular nurse practitioner, and then tell them your symptoms, and then they will give you guidance. Because we are dealing with an individual situation, so you have a disease, but we're also dealing with a pandemic in the community where we want to limit spread. So the best thing is to ask your doctor or the provider for guidance.
And let me ask you one more, and then we'll open it up because I see some of the questions. A lot of people are thinking this. So let's say you stay home, you never have to get a test, you get 15 days through this, you feel better. Do you have optimism that someday we're going to be able to tell if at any point you had this virus or if you're still susceptible when we begin, for instance, opening back up the economy or society, I guess?
I don't know that there's always a way to know if you had a disease because you can go and find antibodies against the disease. So you can do a blood draw and then in the lab, they can look to see if you've been exposed to it. Now, since this is so fluid and this is such a new disease, I don't know that we're going to be able to do that with this particular disease. So that's an unknown. So we might not be able to know if you ever had coronavirus. There is a high likelihood, however, that if you have a flu-like illness in the middle of this epidemic, it's going to be coronavirus or the flu that still occurs. But there's a good possibility that it's going to be coronavirus. But we may or may not be able to tell retrospectively, meaning looking back. I'm not sure that we're going to be able to look back in the future and say you had coronavirus. But the good news is that if you just had a flu-like illness and it went away, then that doesn't have any implication for your future. When they open the economy, when everything goes back to normal, you'll be just your normal self.
Well, thank you. We'll go down to questions. Again, star 3 if you want to ask a question. We've got a lot of questions in the queue. We're going to do our best to get to as many as we can in the time that I have with you, again, with Dr. Brito. So thank you for being here. We'll go to our first question. It's Priscilla in Chatsworth. Priscilla, how are you?
I'm good.
Good. Go ahead with your question. I hope you're staying healthy out there.
I am. My suggestion, Adam, and I met you in Gibson City, and I went to church with your dad. And here is my suggestion for people that are getting frustrated being shut up in their homes. I go outside I'll walk anywhere from 6 to 10 miles in 2-mile increments. And I have my oldies music with me. And what that does, it elevates my mood. It makes me walk at a brisker pace. And if I see some residents in town going by in their vehicle, you can't imagine how great it is to see somebody wave at you. And I do feel like we will get through this, but we have to be patient. And I breathe in that deep, fresh air as much as I can when I'm out for a walk. So that's just a suggestion for people to cope.
Well, thank you. And, I appreciate that comment. I think that's important. And by the way, after you, I mute you after you ask the question. So if you try to talk, don't be offended if we can't hear you. It's just how the system works. But Dr. Brito, when we talk about what Priscilla's kind of point was there about mental health, my wife and I just a half hour ago went out for a real short walk. Made a difference. It's kind of rough because it's cold outside, but the weather's turning nice, although I don't want it to be too nice because then I'm just going to be mad I can't be outside the whole time. But can you talk about that, getting out, the mental health side of it, maybe, how to deal with family that are feeling cooped up?
Yeah, and that's very important, Congressman, and thanks for bringing that up, Priscilla. I think that, keeping your mental health and your sanity through these times is very, very important, and for 2 reasons. Number one, you're getting bombarded with these news that seem to, even apocalyptic at times when you hear about them, and then also being in the house for 1 or 2 weeks without being able to go out. So I would suggest if you exercise, then one of the best ways to mitigate that is to just exercise in the home. So you can put a video in the house and exercise. What the congressman just mentioned is very important. You can go out. It's important to know that the way you get this virus is by being in contact with another person, with the secretions with the saliva that comes out of another person, or by touching surfaces. So if you go out and you have minimal exposure to other people, like you go around the block or you go to a park where you can separate yourself by at least 6 to 10 feet from your next human being, then you should be fine. And that goes a long way to keep mental sanity because you're outside, you're not, you don't get cabin fever, especially now that we are in the winter or early spring. The other thing that you can do, some folks, there are videos out there that in YouTube about meditation, about yoga, that people have been resorting to, and some of my patients have told me about that, and I think it's a great idea to use those. Some folks have remained in, especially remaining in touch with your loved ones or your friends is very important. So, in my own household, we've done, the Skype or FaceTime with friends. So have like friend dates or dates with your family members and talk to them over the camera. That's very important. And although nothing substitutes the human touch and being around your loved ones, but seeing them in camera is also very important. So all those things that you can do to keep yourself busy reading, watching movies and stuff will go a long way to help you mentally. Now, there are a number of us, or a number of people who are, who have therapists. So who usually, even in non quarantine situations, they see it is important for them to see a therapist to keep their mental health. And so there are many therapies that are doing telemedicine. So you should consult with your provider because sometimes this can make this confinement can make your deteriorate your mental health a little bit. So I know no provider who would not take a call from you and try to help you through these tough times.
Well, thank you, Doctor, and thank you for the question. Let's go next. Again, this is Congressman Adam Kinzinger with Dr. Brito. For those just joining, we're taking your questions. There's a lot of fantastic questions. We're not going to be able to get to everybody, so I'm going to try to get as much of an array of questions that people are wondering. One of those, I'm going to go to Artis. I think it's Artis in Rockford. I had a question about, shutting things down as well as, what's the difference between this and the flu? So, Artis, you on the line?
Yes.
Go ahead.
Well, I guess my question has to do with the vagueness of the situation where everything's shutting down and yet we don't see any actual evidence of the disease because we're trying to stay ahead of it. But I guess my question has to do with how will we know that we are ahead of it? How will we know when it could possibly end? Is there any scientific criteria or goal that we're headed to so we can see, we're actually reaching our goal by staying indoors? How do we get any kind of reassurance that what we're doing is working, as opposed to influenza, whose season lasts until the end of the summer and whatever, or to the end of winter? How will we know?
Well, that's a great question. I'll turn it over to the doctor, but let me just say it's part of something I've been wondering, which is, it's almost like when you talk about a war on terror. If there's no terrorist attacks, does that mean terrorism isn't a threat, or does that mean you've been successful, and how do you quantify that? Yeah. And I guess the question is, if we're successful in this, doctor, what does, in your mind, success look like? And ultimately, will that give fuel to the people that think this wasn't a big deal in the first place? So, Artis, thank you for your question. And doctor, what would you say to that?
Yeah, that's a great question. So I got to first point out what I said in the beginning. There are 1,200 cases in the state of Illinois, and there have been 236 new cases just reported in the last 24 hours. So even though we're not seeing this at the individual level, rest assured that us, the healthcare personnel, are seeing the disease in the hospital. So it is occurring. What we want to do is we want to blunt its effects. So by preventing people from cohorting or by having people stay in their homes, then we are effectively, since it's a disease that is spread person to person, we're halting transmission. We're stopping the transmission as best as we can. I mean, these things are not infallible, of course. You see, I've told you we have 1,200 cases, so it doesn't work 100% of the times. However, it blunts the response very much. Not seeing the big numbers that we're seeing in other countries, or the big numbers that the experts forecast at the beginning of the epidemic, will be a success. And ironically, you're not going to, if we are successful, then you are going to see less cases of the disease, and then, the quarantine will end, and then you have a reduced number of cases. And then some folks might say, well, this wasn't a big pandemic to begin with. Well, I can assure you, and I'm not the one who makes these estimations. I mean, folks, based on the epidemics and what's happened in other countries, because we humans are very similar between one another, regardless of borders. We can estimate. We can estimate what's going to happen here if we don't do the quarantine. So if at the end of 2 weeks or 3 weeks or however long this quarantine is going to be, we don't get to those numbers that the experts project, and we're much less than that, then that would be a marker of success. But rest assured that if we hadn't done that, I know it's very difficult for folks who may not believe that this is a big deal. It's very difficult to grasp that concept. But if we hadn't done it, if we hadn't taken the measures, those measures, then there may have been a worse outcome. So
well, and I think that's one of the. Go ahead. I'm sorry.
No, the congressman gave the example of the war on terror and stuff like that. There are some of these things, and that's not my area. That's more his area, of course. But if you give you an example, I mean, nobody applauds the attacks that never happen. People, if they don't see it, they don't see the things that happen behind the scene of our government is doing to curtail these things and to thwart those attacks. It's the same thing here. Even though you're not seeing behind the scenes, that you're at home just a little bored and whatnot, rest assured that there are cases coming every day to the hospitals, and we risk being inundated with cases if we don't have people stay at home, and then we risk the medical system collapsing and doctors getting infected.
I think that's an interesting point. So what I've kind of come down to see is, I think I read somewhere the flu. For everybody that gets the flu, they'll infect generally 1.2 people. This is somewhere around, for everybody that gets this virus, 3 to 4 people, and it may be more. We're hearing that there may be a ton of people walking around asymptomatic or very light symptoms. And the good news to that is it means that, this is actually going to burn, I hate to use the term, but kind of burn through the population faster, and we'll get through it. The bad news is the difference between a 1% fatality rate and a 10% fatality rate like we've seen in other countries is access to health care. And our biggest concern right now, when you talk about lowering that curve, is making sure that if you need a doctor or a hospital, you have access to it, because, the heartbreaking stories we're hearing out of Italy where they're having to triage patients and because they don't have enough capacity, that's our biggest nightmare. And so, getting the flu or getting this may feel similar, may feel different, but I think the concern is how quickly, if you think about it, this was discovered 3 or 4 months ago, and it's already in every country in the world. And, and I saw yesterday, in the last 24 hours, we've had 10% increase in cases than we've had in the last 4 months. So you can see how that accelerates to that level. Let me go next to, I think there's a question a little about the political side, because I know that's on people's minds too. We'll go to Poplar Grove. Phil. Phil, you there?
Yeah, I'm here.
Hey, Phil, go ahead. Thanks for spending the time.
Adam, thank you for doing what you're doing to help the people stay better in tune with what's going on out there. Speaking of which, my question is this. We have what's it called? Act 3 of this current situation going on in the Senate right now. Yeah. And it was supposedly a foregone conclusion as of yesterday afternoon. Now we go to yesterday evening and this morning, and here comes the Wicked Witch of the West bringing in a new program that is basically blowing everything up with nonsensical, non-virus related issues that she wants added. What is your position on that? Number one. Number two, can we not get around this? Is this act the end-all, be-all, or can we do another one next week that would make the Democrats a little bit more happier than they are now? What do you think?
Well, hey, thanks, Phil. And obviously that's better for me and not the doctor, so I'll answer that. But, look, it's disappointing. This is a time, we don't like spending $1 trillion or $1.4 trillion. Obviously, there are moments when we have to do something like that. This is one of those. Nobody foresaw this coming, even 5 months ago. But what's been amazing to me is all weekend, Republicans and Democrats in the Senate were negotiating this thing. they had an agreement, and then 5 senators on the Republican side had to quarantine themselves because of their being exposed to this virus. And all of a sudden, Nancy Pelosi made the decision to fly back to D.C. and said, hey, this is an opportunity for me to get everything I want. And, Jim Clyburn said basically the same thing. He said, this is our opportunity to change things permanently, in essence. And so the 3 demands that they're making is, number one, they want the airlines, if there's going to be support for the airlines, they want them to reduce carbon emissions. Look, I'm all for reduction of carbon emissions. I don't think this is the time where that needs to be our highest priority. The second thing they're pushing for is, wind credits, tax credits. Look, is this the time where we really need to deal with that? And then just some other egregious stuff to where I was reading that, in fact, Nancy Pelosi's bill that she's authoring is $2.5 trillion. So it's extremely disappointing. I think even my friends on the other side of the aisle are embarrassed by what's happening. I'm still optimistic we get through this today. I think it was an attempt by Nancy to see if she could win over the population, and she's not. Let's just get this done. This is a moment where, look, there's going to be politics, and, we all have our political stripes, and we're all going to be political. We need to be. That's why, people vote for and hire us. But there's moments when we have to get out of that and look at the big picture. And this is that moment where we have to look at the big picture. And so we're going to keep trying to do that. I also, you thanked me for my service. I appreciate that. I want to do that. Look, we thank a lot of the times the military for their service, and we're very appreciative. But today, we're obviously seeing people like Dr. Brito, like the nurses, like the technicians, and even the people that are going in and working, the Walgreens or working your gas station, people that are considered essential employees right now, and especially those in the front lines of the medical community. It's a moment where we realize how thankful we are to have them. And so I'm glad you brought up that appreciation for people. So thank you. Next, we're going to go to Michael in Rockford. Michael, are you there? Go ahead.
Yes, right here.
Hey, go ahead. How are you?
Okay. I'm okay. I read everything I can and listen to everything I can. My question is, I think, of a little interest here. I am a retired medical doctor, so it's kind of interesting to me. They're talking about blood type difference, and I've been hearing and reading a couple of spots that A blood type seems to be a little more less resistant, let's say, to the virus, while people with O blood type are maybe a little less. And I just wondered if this is something that they keep track of, or if they are coming out at all anywhere, if on that type of a, it doesn't take much to do, it doesn't take much to study that, just mark it down as they're going through everything. And I just was curious whether they were coming up with any true results.
Well, thank you for that. And as an A blood type person myself, I'm especially curious. So thank you for the question. Doctor, let me ask you, so on the issue of blood type, and then let me make it a little larger, on the issue of, what kind of metrics are being tracked for everybody that is tested so that we can learn, and are we learning every day more about this disease? So go ahead, doctor.
Yeah, so interesting question, Doc, and all these things that are coming out in terms of symptoms or characteristics of the patients and being related to severity of the disease or how severe the disease is are what's called observations, statistical observations. So they take this particular study that you're referring to is out of China, where they take all of these people who were infected, and then they look at a subgroup, a smaller group. In this case, I think it was like 2,000 of those people who were infected. And then they look at how many of those were A positive, A negative, A, B, O, and stuff. And then they come up with a different degree of disease based on the blood type. Now, if diseases typically don't discriminate by blood type, so if you see it spread in the population, if you see a disease present in the population, then the blood types, if you take 100 people, then it should be very similar across blood types. When you see one being more common or more frequent, getting a more severe infection than the other, then that makes everybody curious about why this association is. And this is when us doctors and researchers say this needs further study because it's just an association. So it's just an observation from the patients who had the disease. However, think about it this way. Let's say they took the 2,000 people that came from a specific village where there is something tied to blood type that makes every disease, not just this disease, more severe. Or that there was a problem with the blood bank in analyzing the blood type and whatnot. So these associations give us ammunition to make hypotheses, so questions for the next study. So now what we do then is then look at it, what we call in medicine prospectively, like forward. So you take a bunch of people with type A and a bunch of people with type O, and then you, in a pandemic situation, for example, you follow them over time and then see if they truly get more disease, the A's compared to the O's. I don't think that's going to be doable here because this pandemic will come to an end someday, and we don't have enough time to follow all these patients. But that's how you would prove an association like that. There's also an association difference between men and women. Yeah. Where it's saying that men have more severity than disease than women, but you have to analyze. I mean, what kind of not all men are created equal in that sense. I mean, it may be that the group of men were sicker, meaning they had more diabetes, more COPD, or more all these other conditions that complicate an infection with coronavirus, and the women were healthier. So it's a mere observation. We need to prove it beyond doubt as much as we can do that in science. You'll have to look further and look probably prospectively. And some of these things are probably not going to pan out. We're not going to be able to investigate further because we're interested in more other stuff right now, especially taking care of people. But some of it, with time, some of it will be proven either wrong or right. This is just preliminary observational data.
Thank you. Some people would say that men just complain more when they're sick. So yeah, maybe there is some science. Maybe it actually does feel worse for us. Again, everybody, this is Congressman Kinzinger here with Dr. Brito, and we're taking your questions. There's a ton of questions. We've got about 10 more minutes. I'm going to get as many questions as we can, and then before we're done, I'm going to wrap up a lot of the kind of questions people have said, and I'll just ask the doctor to talk about them. But at the end of this call, if you didn't get a chance to ask your question or you want to leave a message, it'll be like an answering machine. You can leave that. We'll get back to you. As you know, I'm at home. My staff is at their homes, but we're teleworking, and so technology actually, for something like this to hit, the fact that technology is where it is, that timing is well. I want to go now to Cherry Valley to Wanda. Wanda, how are you today?
Oh, I'm fine. How are you?
I'm good. Thanks for taking a little time with us.
Sure. Well, my question was, how safe is it to go to the grocery store if you follow all the rules that you're supposed to follow? A lot of my friends are having groceries delivered. And I'm 75 and healthy. Just wondered if I should have groceries delivered or if it's safe to go to the grocery store.
Well, thanks for the question. I think first off, delivery is a great option for people that are, worried, and they, and if you live in an area that has delivery, I think it's a good thing to take advantage of, or family. And if you have nobody that can bring you groceries, worst case, call our office. We'll figure out how to make sure that's taken care of. But doctor, do you want to talk about, this lady is 75 years old, she's healthy, but is wondering about going to the grocery store. Do you want to address some of that?
Yeah, absolutely. Thanks for the question, Wanda. I mean, I think that absolutely, as the congressman said, if you can get the groceries delivered, then it's better, right? Because you get less exposure to You have less human contact and less exposure to surfaces, meaning you don't have to open doors, hold the cart, the shopping cart, and stuff like that. And then so you have less possibility of getting infected. The person who comes and delivers your food will leave it at the door, will walk away, and then you take it. And then after you put everything away, you wash your hands, and then you'll be fine. When you go into the store, although you have much less people than you usually have in a store, and the store personnel are more aware that they need to keep stuff clean, so they're cleaning the carts and stuff like that, you do run a higher risk of getting infected. So if you can, I assume that some of these deliveries can be a little bit more expensive. So if that is not a barrier, if you can afford it, then I think it would be a safer option.
Okay, thank you. Next, we're going to go to Waterman, to Peter. Peter, are you there?
Yeah. Hi.
Hey. Go ahead. How are you?
I'm fine. Just wondering, it seems like that's an awful large number of new cases in one day. Is that what was it 2 days ago, 3 days ago? How many new cases came in compared to that came in today?
I think it was more testing.
Well, good. Thank you.
Could have been more testing too.
Yeah, that's true. Doc, do you want to talk about just the increase in cases from the level of, how much, I guess we don't fully know the answer, but how much is actually new people getting transmitted the disease versus testing, and just kind of your overall theory on, I guess, that spike of numbers we're seeing?
Yeah, I think that, as Peter pointed out, I think that, I think it has a lot to do with increased testing. So we are slowly getting to the point where we have the actual number of people, the symptomatic people, because as the congressman alluded earlier, there are a bunch of people who are asymptomatic and will never know that they have the disease. But we're getting slowly to the point where we know the actual number of cases that are infected. So these spikes, since it's been so early since we started instituting these measures, have a lot to do with more testing. So people are just getting are more aware of the disease. They go to the doctors, they get a test. We are now not only the Illinois Department of Public Health, but there are private labs running the test. There are also universities, like our university just went live today with our own homegrown testing. So there's bound to be more cases that we're out there and that we're finding. So the peak has to do with that. But also there is a component. I couldn't give you a breakdown, because nobody knows really that, but there is a number of those cases that are new that are just, they're true new cases that are coming into the system. But there is a component, absolutely, there is a component that has to do with increased testing.
Thank you. We'll take another question, and then this will be from Christine in Rockton. Christine, I'll put you on in a second. We'll take her question, and then I'm going to kind of compile, since we're down to about 5 more minutes, I'm going to kind of compile some of the other questions and then ask the doctor those, or address some of the other questions in the last 5 minutes so we can get across as much of this as we can. Again, we're here with Dr. Brito. Doctor, we appreciate you taking the time, by the way. The next call is it's Christine. Christine, go ahead. You might be in Winnebago or Rockton. Christine, are you there?
Yes, I am.
There you go. We can hear you. Go ahead.
I was wondering if they say that this flu or virus or whatever you're going to call it is supposed to return in the fall, and if it does, is it going to be a mutated form, or is it going to be worse, or what?
Well, thank you, and Doc, you can address that. And one of the questions I had, too, that I'll add on that is I had actually heard that one of our great hopes is that this does mutate, because unlike in the movies, mutations can actually be good, and they can cause a virus to die out instead of like in the movies where they make your eyes bleed more or something. But Doctor, can you talk about the fall and then the possibility of a mutation?
Yeah, the real answer to Christine's question is the following: we don't know. And I know that's not satisfying, but that is the truth, and I gotta convey the truth to you. So I think that it is a novel virus, so we have never dealt with it before. The experience with other viruses that are cousins of this virus, like the SARS epidemic. You may remember SARS back in the early 2000s or the late 1990s. It went away. We haven't seen it again. This is a new virus. Has nothing to do. They're related in their family. They're cousins, but they're not the same virus. So there is a possibility that it may come back the following season, by the fall, following cold season, or there is a possibility that it may die out. We don't know that. The best educated guess for people that know about this more than I do, people think that it's going to be an issue for the next 12 to 18 months. And so that, we're going to be, that doesn't mean that we're going to be in this state for 12 to 18 months, of course, but that there's going to be people getting infected to a lower degree than what they're doing now for the next 12 to 18 months. But I got to be very honest, even the people that are saying that, the experts that are saying that, don't know that for a fact. So it may be that by July or August or September, this will be gone. It may be that we're still dealing with it in some form or another. About mutation, I don't know that it will. I don't know that it will mutate and become any worse than what it is now. And I don't know that there's any evidence to that effect. Now, influenza, as you know, there is a seasonal influenza, meaning the same that comes every year and affects a number of people, and it's pretty predictable. We even know more or less the number of cases that we're going to have in a season and whatnot. But occasionally, some of these viruses combine and then it gives from those combinations or rearrangement, as we call it, new viruses come up, influenza viruses, like the H1N1 that you've heard, and then they become pandemic. Meaning it happens the same thing with influenza that it's happening now with the coronaviruses. So they go all over the world. They have a higher mortality and stuff like that. And we've had examples of that. We had the Spanish flu, which is an influenza, 102 years ago. That can happen with influenza. I don't know that that's going to happen with this virus. So I don't know about those mutations and if they're going to be. But I don't think so.
Well, thank you. I'm going to address real quick kind of the economy. There's a lot of people that ask questions about that. And then, Doctor, I'll pass it to you for one last kind of question and your closing thoughts. Again, stay on the line if you guys didn't get a chance to ask your question, because you'll be able to leave a message. But a lot of people are asking about the economy. We don't know when the economy is going to get back to normal. We don't know the process for getting it back to normal. If there's a way that, people that have had the virus or people that may not be as susceptible, younger people, you can still get complications if you're young, but it's less likely. There is a trade-off. There is a real decision, a really tough decision that we're going to have to make in terms of, what's the risk reward versus keeping the economy shut down, and obviously understanding the massive hit to that. I'll say this. I'm committed to making sure that everybody in the 16th district and frankly in the country, we're all going to suffer some pain here, but that we do our best way to get through this, that the economy is fundamentally strong. An economy is basically just people's human interactions, and they're slowed down right now because we're asking people not to interact. But the housing market is strong, unlike in 2008. The banking system is still strong. And I think that bottom line, when we get to a point where we can turn this back on, we'll recover very quickly. But we're going to do what we need to do in D.C., I hope, if my friends on the other side of the aisle get on board, to get money in people's pockets in the short term. to make sure that businesses stay in business. There's a lot of small business owners on the line here that are worried about that. And we just ask you to continue to reach out to us. We're hearing the heartbreaking stories. And my hope is in a few months we can look back and say it was a challenge, honestly, similar to World War II. We didn't get bombed in Pearl Harbor, but we're getting bombed with this disease everywhere that we can look back on a country and say we overcame. Doctor, as we close up, let me ask you, can you talk about, a lot of people have asked about PPE, the stuff that prevent, the masks, the face shields, all this. We are continuing to get to the bottom of why these are behind. I think one of the big things is we expected something like this, but how do you frankly plan for it? If we had 1 billion masks sitting around, people would say that we're wasting resources. But Doctor, can you talk about kind of what you're hearing out there about this PPE issue and the importance of it, and then any closing thoughts you have?
That is a real issue. We're experiencing in our medical center, and I know other medical centers are experiencing it as well. And I think it has a lot to do with what you just expressed. You're not every day you have an event like that. So, and we project, hospitals project how much they're going to use of this protective equipment based on last year's usage and the year before. And so if you're not expecting anything like this, then this sort of stuff happens when you meet shortages. And we're proactively, here's what we're doing. We're trying to limit within reason, the number of people that interact with the patient. First, to try to prevent the spread to healthcare workers and to avoid the collapse of the medical system. Because if doctors get infected, even if they have a very mild disease, we got to send them home for 14 days. So you can imagine if that happens in a critical number of doctors or nurses or the folks that are on the front lines, then we don't have any people to care for you. And the second thing is that the second reason why we want to limit contact with patients, because we want to conserve or preserve PPE, it's called, is personal protective equipment. So we want to make sure that we use only what we have to provide optimal care to the patient. And even though we haven't run out of it, so we have in our hospital and a VA hospital where I worked also, we have these sufficient for now. We are looking at, being very careful where and when we deploy these resources, because there is a possibility that we can run out, and then we have to come up with other ways, and I don't know of any good way to preserve the health of the healthcare personnel and their families. Remember that their healthcare workers are part of the larger community. So if you have healthcare workers who are sick, not only cannot work, but they can spread the disease to other members of the community. So they are part of the chain of spread, and we got to be mindful of that. So there is shortage in the sense that we project that we are going to have problems, but still we have what we need to care for the patients. But if we continue at this rate, and if we don't we don't decrease or level the number of cases, that can be a problem. And that may be my closing thought is, like, you've all seen that curve. If you haven't seen it, you can Google it, flatten the curve. And, people have been touting that, and, we hear that in the radio and on television. What we want to do is, even if we have the same number of cases that we were going to have, because that's what, our population was going to be subject to, we want to have them in a slower fashion. We want to, when we say we haven't come to the medical centers in a slower fashion, so we don't overwhelm the system, and then we don't, we don't run out of PPE or, run out of beds to put people in the hospital. We're not at that point, and this is where you can help us. and this is my appeal to you and my closing comment. What you're doing is very important. Staying at home, even though it doesn't sound like a great, it doesn't rise to the level of, of great heroic thing. It is very, very important. So please stay home, and that would be the way that we are going to stop this pandemic. This is the challenge of our generation, meaning everybody who is alive today. We haven't seen anything like this in 102 years, and in our lifetimes, we're probably not going to see it again. But it is up to you to stop the spread of this epidemic. And I thank the congressman for putting these kinds of town halls together, because it is important for us, for him in terms of the politics of it, but for us, the healthcare workers, to talk directly to you. It's a great forum, and thank you for inviting me.
Well, Doctor, thank you so much, and be safe, be healthy out there. That's the great point is, the difference, the reason our mortality rate so far in this is among the lowest, tied with South Korea at like 1.3% of confirmed cases, is because we have the greatest healthcare system in the world. We can debate about what that looks like in the future, but we have the best doctors, we have the best healthcare systems, and as long as people with complications have access to those healthcare systems, the vast majority of people will get through this with maybe a pretty bitter story to tell about what it felt like, but they're alive to go home to their family. And in some of these places, like in Italy, where we're hearing heartbreaking stories of having to make a decision to take somebody off a ventilator because somebody else came in. We don't want our healthcare professionals not just to be exposed to the virus and get sick themselves. We don't want them to have to make those decisions. We don't want families to have to make those decisions. And so these kinds of sacrifices of, stay home, be bored, or talk to your family, whatever you got to do, watch TV, is the kind of thing that literally is providing support or ammunition to win this war. So, Doctor, thank you for your input. Thank you for your expertise. And everybody on the call, thank you for being, being patient. I'm super proud to represent this district, and it's in hard moments like this that I get especially proud to do what I do, because it's when our country rises to greatness, and we're doing that. And so God bless all of you. Again, stay on the line. First off, kinzinger.house.gov. That's our website. If we'll keep you up to date on stuff. If you want to reach out, whether Twitter, email, call the office. If you have concerns or questions, but also stay on the line, because you're going to hear a voicemail message, and you'll be able to leave a message with a comment or a question. But again, Doctor, thank you. To everybody on the call, thank you. God bless. Be healthy out there, and we'll hopefully see you in person without having to be 6 feet away very soon. Thank you.
Thank you, sir.